It's day 6, or post-op day 6, after Dr. Gawayne Vaughan, who's actually holding the phone in this situation, did the excision on my left neck, taking a sebaceous cyst out. And so now, Dr. Gawayne, what do you think?
I think it looks pretty good.
You think it looks pretty good?
It's staying together. The stitches are still intact. You can see maybe a little bit of pinkness. That may be a little reaction to the stitches that are having there. Let's see, somebody like, "Hi doctor, how are you feeling?" says
I feel fine.
Kaylin Blake.
Oh, Kaylin. Hi, Kaylin. He watched the procedure.
Oh, but yeah, it's looking pretty good. I think we'll definitely want to get those stitches out tomorrow.
Okay.
Because you're starting to get a little bit of focal reaction, but nothing concerning for infection. That's the biggest thing we're concerned about.
And what would it look like if it was infected?
Oh, well, why don't you can tell us. You're on right now.
Redness, pus discharge, swelling, pain, if there was a fever, if there were red streaks coming from it. Local lymph nodes might be swollen. Also, as far as post-op care, I want to let you guys know that what I've been doing is putting just a thin film.
Stinging or itching? Says Rusty Bernard. Asks.
Occasionally, yes, actually. There is a lot of irritation from the stitches, especially with my collars always coming up on it. I probably shouldn't be wearing collars while this is healing, because it hits it right, right there.
That may have to be why it has some irritation too.
That might be part of it. I have been putting on a thin film of Neosporin, although we actually don't tell people to use Neosporin. We tell them just to use something like Aquaphor that doesn't have antibiotic in it.
Who are just joining, sorry, they just want to know what happened, who were out of the
Oh,
loop,
okay.
what kind of surgery you had.
Okay.
Oh, hey, other people are answering for them. Cyst, says Rusty Bernard.
Thank you, Rusty. Yes, that's why we have you here.
He knows.
It was a sebaceous cyst that Dr. Gawayne had removed on Friday last week live on Periscope, and you can find the old video of it at askdrvaughan.com. So the reason I was using the Neosporin is because I don't have any Aquaphor at home. Otherwise, I would use Aquaphor or really just plain Vaseline, just to keep it moist, keep a layer on it. Also provides a bit of a barrier in case there's still any open area in the wound. And that helps to get better wound healing, less scarring, supposedly, if you keep that nice, moist petrolatum barrier over it. I put it on before I go to bed at night. In the morning I shower, and I don't put something on, even though ideally I would. And the reason is because I don't want to wear a bandage to keep it from getting on the collar, and it would just get all gooey with the collar if I did put it on. I would prefer to have it on, though. Any other questions that we can help you guys with on this fine Thursday noon hour? If not, just remember, if you're not already following, to swipe right to follow. You guys may want to say hi to Jessica. Jessica was the one who held the Periscope during the actual procedure, and she has her own Periscope. Oh, got a heart for Jessica.
Oh.
She has her own Periscope. It's called
J Marino 6 2014. I know. J Marino 6 2014.
6 2014.
That's when I got married.
Oh.
Yeah.
Well, keep the hearts coming for Jessica. And thank you for doing a great job at the procedure. We appreciate it.
Yeah, much more stabilized probably than I'm holding it.
And what did I write? Mrs. Mall from Dutch Brothers. I don't know if you saw it. Did you see that she commented on the Facebook, or I think it was on the Facebook for it. Anyway, she owns Dutch Brothers, the local beanery we go to here on like once every 2 weeks for myself.
That sounds inappropriate.
No, beanery, that's a restaurant in Westwood. No, it's a coffee shop. We go there instead of Starbucks. And like I said, about once every 2 weeks for myself. It's a very special treat. But anyway, she wrote something about a comment on the procedure. And I made a comment back about how I would not let Dr. Gawayne have any Dutch Brothers that morning.
That's why we're so shaky right now. I had coffee this morning. No.
So not to detract from Dutch Brothers at all. It is our favorite place. And if they're watching, hi, we love you guys. But I try to keep it in moderation. I got a comment on my bacon socks today. You guys might be interested in them. Patients will often notice, I don't know if that's a real lit or not.
Is that good for your cholesterol?
Patients will, the socks don't raise my cholesterol.
Oh, good.
Come to think of it. Patients often comment on my bacon socks when they see them kind of sneaking out from under my cuff of my too short pants. There's not enough light?
Well, no, there's too much light.
Oh, too much light.
Let me get around
So what
this.
I want to say is,
Oh, there we go. Look at those pretty big.
what I want to say is when patients notice it, I ask them, how many strips do you see? And they say, I see 2 strips, unless it's way down here. And I tell them that I only wear these socks once a week. That's 2 strips of bacon once a week. I'm teaching moderation by wearing my bacon socks that Lisa gave me for Christmas last year.
Once a week.
Okay, any comments or questions that I've been missing? Or you're pretty good about interrupting me and letting me know.
Rusty Bernard said that he saw what was it, larvae removed from somebody
That's
down
awesome.
in Belize or something like that.
That's way cool.
Yeah.
We don't see a whole lot of that here.
The bot fly.
Okay, I will share that there was a patient in the last month who was concerned about having a tapeworm.
Blowfly from a tourist. Anyways.
Thank you, yes. And he felt moving in his tummy and said he removed something from his rectum that was about 4 or 6 inches long.
Rectum? Dang near killed him.
Nearly killed him. So he wanted to get tested for worm. Oh, he also eats raw pork, fish, poultry.
Raw pork.
So he was concerned that he had a worm. And just to let you guys know, they're extremely rare in the United States. These are things people usually bring in from other countries. Tapeworms, as far as I know, don't actually have any movement that could ever be sensed by the patient. But we're testing them for parasites just to give them that assurance and make sure. So that was kind of, you guys mentioned the larvae, so that's why I mentioned that. So if that's everything, let me get this set up. I think you go like that to get ready to hit the stop button, and I'll tell everybody, just keep following. If you don't already, swipe right to follow. I follow everybody who follows me, so then they can comment. And until next time, this is Behind the Camera, Dr. Gawayne Vaughan, Jessica over here on the side, and Dr. Mark Vaughan telling all of you to stay in good health.